Hi, it's Jeff from MGE, and I'm here to introduce this week's tip, which is going to be from Sabri, and it's all about 4 ways on how to get more new patient referrals. Now, we all know new patient referrals tend to be our best patients. Why? They're basically sold on you from the get-go. They've been referred to your office by a friend or a family member who is happy with your practice. So what you're going to be seeing for this week's tip is a little bit different, and it's also very special. What we've done is we've taken an excerpt from one of our courses on our online on-demand training platform, DDS Success, and we're going to be playing it for you today. Now, this course that we've taken the excerpt from is called the Practice Jumpstart. What it is it's basically me interviewing Sabri Blumberg, our Deputy Chief Operating Officer, who is in charge of all of MGE's technical delivery, on what she does with every new client to get them up and running and productive as quickly as possible. So what we did is we took this section on new patient referrals and we've excerpted it, and that's what you're going to be seeing. So with that, we'll go ahead and roll the video. I hope you enjoy it, and I'll see you at the end. So now we're going to talk about something. We just finished external marketing, very brief overview.
Yes.
I mean, I think it's just a big deal in and of itself to make a point that, like, you got to do it.
Right.
Yeah. But now, internal marketing, I know is a big thing for you.
Yes.
You're a huge champion of it.
I love internal marketing.
And people I've seen who do what you recommend get tons of referrals. They just, the keyword being do.
Yeah.
So, all right, so internal marketing, so you're talking to me, I'm a newer client or a
Yes.
new client. How would you explain to me to get this going?
Well, the first thing I usually beat the drum for is that you've already paid for these new patients, right? These are new patients coming from patients you've already paid for.
Okay, meaning I've paid to acquire these existing patients or patients of record.
Yes.
So I've already made that expenditure, that acquisition cost.
Correct.
So anything I get at this point just...
It's free. I've already paid for it.
Got it.
Right? So anything that's free in your practice, you want to hop on, right?
enough.
Because these are the kind, by not doing these things and just getting lazy about it and like just throwing, well, I'm already putting my 4% into external marketing.
Right.
This is how you throw your overhead out of control.
As you can see, she's passionate. She's using the word lazy.
Lazy.
She's passionate about this.
Right.
You gotta get going on this external marketing, you guys.
Right, because as I said, these are by not being diligent about these things, you throw your overhead out of control.
Understood.
Right? Because
Understood.
you're not capitalizing on the things you've already paid for.
Fair enough.
Right?
All right, so here I am, I'm a new client.
Yes.
You get me going on this internal marketing. What's the first thing I need to do?
First thing is you have to assign somebody to be in charge of this.
Okay, and we had talked about earlier on in the jump start.
Yeah.
You know who's in charge of new patients?
Right.
Oh, nobody.
Right.
Okay, so same concept applies here.
Yes.
We need somebody responsible.
Correct, and depending on how many new patients you need, right, from internal marketing is going to determine how many hours a week are you going to dedicate somebody towards this thing.
So it could be something like maybe I have a very enterprising dental assistant who wants
Yes.
to take charge of this, and they can
Yeah.
spend a few hours a week and make sure everybody's doing what they're supposed to do.
Correct.
Okay.
Right?
That
That's
could
if I
work.
just need a few, and that could work fine. If I have a larger practice and I have a lot of new patients I could be getting from referrals, I might hire somebody, and this is their job.
Like all they do is internal
This
marketing.
is all that they do.
So now if I were to hire somebody,
Yes.
okay, that's their job.
Yes.
To make it worthwhile, how
Yeah.
many new patients a month should I expect from that?
I would expect, if a good person doing this, a decent person, an okay person doing this, could be getting 10 new patients a week just doing this.
Right.
And that's from their own efforts. That's not the cards that have been handed out that are now also bringing in
Right.
more referrals. I'm just talking about the silly things like scheduling people's family members, or whenever I'm scheduling a new patient, asking them, so is there...
Well, hang on, I wanna get all these actions cataloged.
Okay.
So hang on, so I'm clear. So I would expect,
Yes.
I know you get passionate about this.
Yes.
So if I'm having somebody full-time, I want 10 referrals a week.
Minimum.
Well, because also referrals,
Yes.
generally,
Yes.
are gonna be the best patients.
Because they're already sold.
Right.
They
Okay.
already know you. You're not trying to sell yourself. You have already been sold by whoever referred that patient.
So if my assistant or somebody at the front's working on these internal marketing actions part-time and they're getting me an extra 10 to 15 new patients, that's great.
That's great.
That works.
Totally.
Okay, cool. All right, good. So now,
Yes.
Okay, good. Let's make sure we get all this.
Yes.
What actions would you? I'm the new client now.
Mm-hmm.
I know you have a whole list of this stuff.
Correct.
Right. What are you going to have me do as a new person? What are you going to have me focus on for this internal marketing? We've got somebody, so I've decided who's in charge.
Yes.
So now what actions are we going to start doing right
Well,
away?
the first thing we tell you to do is to care enough to share a program.
Okay,
right?
which we'll
is-
put a copy of below the lesson.
Correct, which is a fairly passive internal marketing strategy.
Okay, it's cards you give out to friends who then come to the
Yeah,
office.
the biggest compliment you can give us is a referral. Please hand this out to your friends and family.
We put a copy of the Care Enough to Share program at the bottom.
Yes.
And we also have a course here on DDS Success by
Yes.
Dr. Hughes, the referral course, where we have demos of how to use the Care Enough to Share.
Correct.
So you want me to start that right away?
Well, yeah, that's like your irreducible minimum.
Okay.
Right? And the thing that your internal marketing can really degenerate into giving people a referral card.
Got it.
Right? And now I'm going to sit by the phone and wait for the phone to ring.
All right, so it's a bit passive.
It's very passive.
Fair enough.
And it needs to be done because you will get new patients from this.
Right, if I keep handing those cards out to patients, they will come back.
That's correct.
Yeah.
That's correct.
Okay.
So every patient coming in there's a good chance they have other people living with them.
So in their household, the spouse, children,
Sometimes parents,
Fair enough.
parents living next door,
Sure.
right? Or up the block or whatever. There's a good chance that these people are looking for a dentist as well.
That's true, because most of the populace doesn't see a dentist on a regular basis.
That's exactly right. Far less than you think. Like, per the numbers, the actual statistics, up to 60% actually does not consider that they have a dentist, even though they may have seen a dentist
Okay.
in the last 2 years. In their mind, they don't have a dentist.
Okay, someone that they would regularly see, yeah, that's my doctor.
That's exactly right. They are, in other words, up for grabs.
Got it. Okay, so basically you're saying I come into your practice and I have a spouse and 2 children,
Right.
and my parents live down the street.
Correct.
Okay, so what are you going to do with me to get those people as patients?
I'm going to ask you, do you have anybody in your household that is currently not seeing a dentist or doesn't have a dentist right now?
Yeah, I don't think my parents don't really have a dentist right now.
Okay. Could you schedule an appointment for them?
I mean, we can call them.
Okay, let's do it.
Or I mean, but now what am I scheduling them for?
We're going to schedule them for a regular exam and cleaning.
Would it be, is there any kind of a special for these guys?
Yep,
or-
we have a new patient special, applies to all our new patients, including your parents.
All right, so whatever special you're forwarding on the Care Enough to Share card, we're just going to use.
Correct. Whatever you're doing for new patients,
Right.
you're of course going to extend.
Got it.
But the point being that I can very often, the patient can just schedule
Right.
these people or,
Well,
right,
like if
especially
you-
if it's
if
a
you would-
husband or a wife.
Yeah, if you'd gone to a dental office.
Yes.
And I didn't have a dentist.
I would just
we're
schedule
married,
your
obviously,
appointment for
You would
you.
just schedule, Jeff, you have a dental appointment on Monday at 11.
Correct. And
Yeah.
worst case scenario, I could call you and say, hey, honey, listen, I'm scheduling you a dental appointment while I'm here.
Okay, yeah.
Yes.
Fine.
Like everybody knows by now they should see a
Of course.
dentist, okay?
Yeah, no, I'm good about that. I'm good about that. Okay, so that you've got patients coming in. Any other things you would have them do?
Well, you know, people get pretty creative about it, and part of this is creativeness, right? A lot of people are driven by somebody. Your waiting room is ordinarily full of patients that are not your patients.
That's a good point.
Right? Schedule these people.
So now, again, let's just play it forward.
Yes.
We'll play act it here a
Yes.
second. So I'm sitting, I just
Yeah.
drove my wife
Yes.
to the practice, and I'm
Yes.
sitting out in reception reading my magazine.
Yes.
Would you approach me directly, or would you talk to my wife? Well, you are my wife, but you get what I'm saying. Would you
No,
talk to my
I would
wife?
I'm sitting right there at the front desk. Why wouldn't I talk to you? Acknowledge that you're there.
So, hey, Jeff, how are you
Hi,
doing?
Mr. Blumberg. Is there something I can get you to make you more comfortable while you're waiting for your wife? And you go, yeah, give me water or I'm good. Right? Or whatever it is that you say.
Gin and tonic. I'm kidding.
Right.
Uh-huh.
Right. And then I could just ask you, let me ask you a question. Do you have a dentist?
I see. Well, yeah, I used to go, but the fellow I was seeing retired.
Okay. Do you want to give us a shot?
Maybe.
Why don't we schedule you a cleaning and try it? We have a new patient special right now.
Yeah, that's great.
Yeah?
Okay, cool.
Good. And if I have an opening in the schedule, I might just slide you right in. We've done that too.
All right.
You know?
You know, it's interesting. What it reminds me of, just
Yeah.
on a total different note. So, obviously, here at MGE, we've been to trade shows for years.
Yes.
When you go to trade shows, It's interesting because sometimes you'll see people who just sit behind their booth.
Yes.
But then you'll see some people who are proactive. And we've run statistics on this, and we had someone new take over our whole PR branch of the company.
Yes.
You know who I'm talking
Yes.
about. And he went to the trade show.
Yeah.
And our statistics at the trade show went up by, no joke, like 1,200%.
Yes.
Because instead of just sitting at the booth and watching people walk by, he walked out into the aisle and went, "Hi, how are you doing? Will you come over?" It took some guts. It took some confront.
Listen, whoever you assign to this, it's a marketing position. So you have to have somebody who is willing to talk and likes talking to people.
Because you're actually asking this person.
Yeah.
Like the person is the marketing.
That's right. And
Yeah.
how far can you take this? You can take this so far. I had this one office and they had this game and they called it the wrong number game.
Okay.
Where what they would do is they had this competition at the front desk on who could schedule the most wrong numbers. So if somebody would call in wrong number, you're like, whoa, 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 wait a minute. Right? Do you have a dentist?
That's
Right?
awesome.
So how far can you take this? You can take this as far as you want to, and keeping this in people's minds, your staff members' minds, and getting them to play this game and making this exciting and having little prizes attached to it, and being creative about this. That is the job of whoever is in charge of this.
Well, yeah, because again, you think about it.
Yeah.
Most people don't regularly see the dentist.
No.
So and everybody has a mouth.
Yes.
So there are millions of potential patients.
Absolutely.
Depending on where you are.
Your UPS guy, your postman, these are all,
these are all potential patients. Yeah, it's just a different
Right.
way of thinking about it.
That's exactly right. And not being afraid to tell people that it's important to see a dentist and offer them to be a patient in your practice.
Yeah, because we already know all the links between systemic health and dental health, and
Exactly.
it's all there.
Exactly. And as long as you have somebody in charge who's fun and who enjoys talking to people and can think with this and can get the team behind it, internal marketing is a blast.
Yeah.
And can be a lot of fun for everybody.
And it's something you can see immediate joy from.
That's right.
Sometimes you do a marketing campaign, you're not going to really see the results for a week or two weeks,
Correct.
3 weeks. This you can see a result immediately.
That's exactly
which
right.
is awesome.
That's exactly right. So there's not a person that you touch that you cannot get a referral from. I mean, even when a new patient calls in and schedules, right? That new patient that called in and scheduled probably has a family.
Yeah.
So why not just ask them? Say, can I ask you, while we're scheduling you, do you have anybody else in the family that we should be scheduling as well?
And then you just get the same new patient.
That's
special.
right. Any children, husband, spouse,
Interesting.
wife, schedule them at the same
Because you
time.
could extend this concept. Let's say I'm doing reactivation calls for
Yeah.
patients who are overdue for cleanings. I get them on the phone, I'm scheduling them, I could ask the same question.
Correct.
Wow.
Right. Anybody you touch knows people that could be patients in your practice. That's internal marketing done well,
Awesome.
right? And could be a lot of fun, does not have to be a drag. You have to put the right person in charge of this.
No.
Some people like doing this. Do not give this to a shy individual.
Right.
Just like you wouldn't make somebody that doesn't like blood your assistant.
Right.
Right? It's a personality that you put in charge of this.
That makes sense.
Yeah.
All right, well, I think that exhausts our jumpstart.
That is the jumpstart, guys.
Is there any last things you'd like to say?
Yes. As you are looking at all of this, and as you're looking at this overwhelming amount of data that you just got, pick the things that are most important to you. You know your practice, right? So you know which ones are going to have the most impact right now. So you pick your own actions to implement, and implement one thing at a time, and keep it in. Don't implement 20 things halfway, right? Implement one thing, get it in, right? Make it a new normal, implement the next thing.
Makes sense.
Yeah?
So, I'm really glad. Obviously I know Sabri very well. We finally I wanted to expose your thoughts and your whole thought process, because any MGE client you talk to that knows Sabri loves Sabri. And I always want to, I know I can say this. It's like I don't say, oh, I did a great thing on but any client that knows you loves you, because you really know your stuff and you really care.
Yeah.
And I've been wanting to expose, people to what you had to offer as far as knowledge.
Yes.
Right? And I thought this was a perfect opportunity to do it with the Jump Start.
Correct.
Right? It's been, truly just, even though we talk all the time, this has been a true pleasure for me to do with you.
It's been fun for me, too.
Yeah, I appreciate you so much for doing this. I hope you guys enjoyed it. I've tried to be an as unobtrusive an interviewer as I can as
You are
I go
great.
through this. Yeah.
Yeah.
And listen, My last message is do well, apply what you learn like Sabri says, and we'll see you back at the next course. Thank you very much. I hope you enjoyed that. I had fun making it, and Sabri, as you can see, really knows her stuff. Now, if you'd like to know more about DDS Success, our online on-demand training platform, you can find out more by going to ddssuccess.com. You can request a free demo right on the site, and you can get a bit of a tour of the site and see how it works. If you'd like to know more about MGE, you can go to our site, mgeonline.com, or call us at 800-640-1140. And if you'd like to see other tips like this, don't forget to subscribe below and click the notification button so you're informed as soon as they come out. We'll see you at the next tip.